Good morning. I am Dr. Malhotra, an obstetrician and gynecologist in Agra at Rainbow Hospital, and today we are going to take you around to an ideal operation theatre set up for cesarean section. So let us see, we are outside the operation theatre. We walk in, we are in our normal clothes which we wear in our OPDs, and if you see, I wear working clothes, and I don't, ladies who wear saris and all, please, during your working time you have to wear some working clothes so you can get out of them easier, because cesarean section could be an emergency and you could be called any time. And please don't scrub up over your saris. So then we walk up into an ideal room which is outside the cesarean section, which is called as the change room. And in the change room we will go straight into the change. Now when you go for a change, again a lot of operation theatre has seen that they change into the toilet. Now that is not the ideal change. The toilet is there in the doctor's room, and there is a change room, or doctor's change room what we call. And doctor's change room, as you go, it's separate from the toilet. So you cannot change your sterile clothes in a toilet. So when we go in, as you can see, we have hanging clothes which I'm going to take off, and we have sterilized scrubs which are lying for us. So we will go into scrubs right now and come back and go into the OT. So now I am in my sterile scrubs, and we will go walk towards the OT and see what we have to do now. So we have a chair which is just outside for changing into your shoes, and for the shoes, for an obstetric unit we use gum boots, because a lot of blood and liquor is going to fall all over us and contaminate in your clothes and your feet. So it is ideal that you use gum boots, sterile gum boots, which were lying in the sterile area, so that you don't get contaminated and your hand and feet are not disturbed. So this is how we will go, and then we walk towards the cap and mask table and change into a cap properly, and we change into a mask, and the masks are of various types. So we use the surgical mask, as you can see, and which has pleats and a nose ring. So now depending, see, if you are wearing a specs and if you wear with the pleats up, so when you breathe out, the air may leak up and fog your lenses. So you could wear it when your air goes down, but it's ideal that we wear the mask with the pleats up, and we cover the nose completely and we don't let air go in by. Then of course we have the wash area. The wash area is operated by foot or operated by hand, and it has sterile solutions, and it has instruction for hand washing, which should be strictly followed. 5 minutes of scrubbing in between, scrubbing circularly at each arm, scrubbing each finger circularly and scrubbing too, and then washing one by one with the fingers above the elbow. So if you don't wash it like this, you have to wash it like that, and then of course we change into a towel or take a sterile towel to wipe ourselves clean, and we wipe our hands dry and then dispose the towel and then take some sterile alcohol to scrub your hands. And then of course we walk towards the operation theatre. So here we walk, here this is a labor suite which we have. The labor room is right next to our cesarean operation theatre. Sometimes we may have to do cesareans here also. So we have an ideal labor bed which can be shifted, a monitor, a LSD monitor, and everything to deliver patients normally here. If they need a cesarean section can be done here also. But this is not the ideal because the bed is very wide. So your assistants will have to lean if the bed is wide for cesarean section. But for laboring patient, a wide bed is needed because they need to turn towards the side somewhere. Then the ideal cesarean section OT is something like this. Now here you see it's a gynec OT, so you will see some endoscopic equipment also. But first, it's quite intimidating for the patients to walk into a gynec OT because they see a lot of equipment all around. So the first thing is console, then the anesthesia machine, because we use epidurals and spinals in cesarean section anesthesia, but still everything for general anesthesia is kept ready. So if the epidural fails or if there is an emergency, everything is loaded for each patient. Now it should not be, this should be all present on the anesthesia machine with the anesthetist being ready for any sorts of emergency. You cannot make the patient run to the drugstore to get a pentothal or to get anything. When we come to the OT table, you see this OT table is narrow. And it is narrow because you can stand on both sides, so the pregnant woman's abdomen does not disturb your operating field. Usually the surgeon stands on the right of the table, and the first assistant, instrument assistant, and there is a circulating nurse. The circulating nurse has to be moving all around, and she is the one who is going to handle the non-sterile areas, but she also has to be gloved. So, and then of course everything for spinal anesthesia should be ready before we start the operation. Everything for cesarean section has to be ready before we start the operation. An ideal OT will have a console which will tell you the time which is started, what is the temperature and humidity of your operation theatre, what is the air condition controls of your operation theatre, and how much time you have taken, and when you bring out the baby, whether it's too cold or too warm. It also has all the setup for all the equipment for proper waste disposal in the colored buckets, which are all sterile, so you don't have to dispose, and you should know what to dispose. A suction machine for emergency, otherwise the suction is on the console. All the equipments which may be needed in an emergency, a special cupboard which is double locked for narcotic drugs, because this is very important. They cannot be bought in the pharmacy. According to the guidelines, narcotic drugs are double locked with a key with the anesthetist and the OT assistants only, and that has to be issued. You see a lot of consoles, so everyone who is moving around the operation theatre should be careful of a console. Now this is an ideal operation theatre. It is not possible to have ideal operation theatres in village setups or small setups, but as near as ideal, because cesarean section may be the simplest of operation, but in an emergency it could become the most difficult of operations and may cause chaos. And when chaos occurs and everyone runs around, then actually you are not able to handle what is happening or what is wrong with the patient, or if there is a PPH. So everything for handling PPH, for eclampsia, those sets are kept separately in the labour room, which can be brought immediately. And a whole drill has to be done for a cesarean section. So everyone who's in the OT, they have to know what their job is, and they have to know and circulate, so they don't come into the sterile field, yet they know what is happening, and yet they know what to do and what to handle when emergencies happen. So if you are a youngster and you're going to do cesarean section, open up your nursing home. It is better that you invest in a correct, modular OT, which may be of small scale, not very expensive, but which should follow all the guidelines, especially guidelines of lighting, using LED lights, using a very good anesthesia machine and monitoring machine, being prepared for all emergencies, and of course have the right table which can be shifted electronically up and down, so that your job becomes easy. And of course all the equipment and the drugs should be there. So that is something about what an ideal cesarean section operation theatre and a labour room suite should have. I wish you all the luck in this workshop which we are conducting here today, and we'll be very happy to answer any questions you have on what equipments and instruments we should be having. Thank you very much.